Welcome to CareTalk, your very best home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Welcome.
Hey, John, let's talk some deals today. It's big news. Teladoc is acquiring Livongo for $18.5 billion. I mean, what are these companies anyway?
Look, it's an insane price for relatively early stage companies, but it's more about, David, the opportunity than the performance currently. Teladoc is the leading virtual visit sort of telemedicine company. Jason Gervich, the very able CEO, swashbuckling actually, given this deal, leaned in early to help actually permit and push regulations to permit more telemedicine, because up until COVID, the entire medical industrial complex was fighting him. Livongo is another digital health company, but more of a chronic care management, tech-enabled services business. What really telemedicine was set up to is get you access to a doctor on demand, and for those urgent visits where you really wanted to deal with it at home. But there's a lot of promise in telemedicine, even though the traditional docs in hospitals and neighborhoods were fighting. Livongo was really set up for another tech-enabled service to help patients manage their diabetes. Both of them leverage a lot of data, but Livongo particularly is built on sort of a coaching model as opposed to a doc model. Both of them rely on technology, and really what this represents, and the reason why companies with very little, if not negative earnings, are getting an $18.5 billion valuation, they are creating the digital front door for telemedicine and for coaching, and starting to leverage technology to not just lower the cost of access, but maybe also create more informed care, service, and information. I think it's super exciting.
Well, John, both of these companies have done some deals in the past, relatively recent past. I mean, Teladoc, as you said, it's been around almost 20 years. They acquired InTouch, Advanced Medical, Best Doctors, and others. And Livongo has also acquired a couple, My Strength and Diabeto. But I guess they looked at one another and said, this is the way to go.
Well, I think when you've got very cheap public stock, which is both of them are incredibly highly valued. I still don't think that, I may be wrong here, that Teladoc has earned any sort of GAAP earnings, but they have been reducing their burn and increasing their reach and revenues, and dramatically growing their revenues by acquisition, and also organically, and providing probably the best telemedicine services out there. And there's a lot of other great telemedicine companies behind it. Livongo was a breakthrough diabetes tech-enabled service where they would take the information about the thing about diabetes is you're taking those blood sugar readings on a regular basis. It's an incredibly complicated disease. And if you can get a coach and maybe some automated algorithms to help you, that's pretty promising. Diabetes is incredibly expensive. Both of them heavily leveraging technology, but even more heavily leveraging public stock that is highly valued to scoop up other companies that have competencies. And obviously, this is promise before performance, but it's pretty darn exciting. And what do you think the results will be of this deal? Because I'm really thrilled for both of them.
John, it seems like someone served you a little extra Kool-Aid in the home office today. I think this is
poo-poo progress. You're just a stick in
so,
the
John,
mud.
what I would say is, so theoretically, they're putting together telehealth, with doctors from Teladoc and chronic care management, coaches from Livongo, like you said. So it's a nice little benefit package for employees. Maybe there's going to be some cost savings for avoiding in-person visits. But I mean, overall, I think it's kind of a bit of a yawn, John. I'm like a little tired.
Cost savings? My God, wouldn't that be a great thing? You engage in the healthcare system and it's cheaper. You're just defending the overly expensive establishment that just won't change. What's wrong if I get sick, if I call a doctor and get great service using my iPad, my phone, or my computer? Are you going to wait at home until you can set up an appointment, maybe a week from now, to then spend half of the visit filling out forms before you get to see the doc about your alopecia? I mean, come on.
John, it's just routine baldness, I think. So I don't really need to see the doctor for that. I think you could see it. I saw my eyebrows, so we're probably could make that diagnosis myself. Yeah, but John, I mean, here's the thing. I mean, do you really think this is going to make a big difference in healthcare? I mean, we talk about like the iron triangle of, quality, cost, and access. I mean, how is this really going to make any difference?
I think it's gonna be huge. And I say that even though I risk quoting Donald Trump. There is a need
Your
for
pronunciation
radical
is different, John.
with a radical collapse. The cost of getting anything done in healthcare is ridiculous. You're paying for all this unnecessary infrastructure. You're also every consumer pays the cost of taking the time to set up an appointment, driving to the doctor. I mean, healthcare is it's probably the most inconvenient service in America. And it's also one of the most expensive. The opportunity to provide intelligence on demand, leveraging the digital tools of Livongo, access, leveraging what Teladoc is doing, and simplifying access to coaches and doctors. No, I do think this is a game changer. And it's, again, the promise, not the performance, that's getting this rich valuation. And David, you can't always be anti-technology.
No, not always, John. And in fact, I think that I like technology. I really do. But I think that we shouldn't exaggerate what the potential is here. If we put this in perspective, the $18.5 billion, even though it's sort of funny money, as you admitted, is a big deal. But this company combined is a tiny drop, or even like droplet, in the $3 trillion ocean. Let's just hold on, John.
Armchair.
$1.3 billion. Okay. So just to put that in perspective, that's less than half the size of one of the smaller medical centers in Massachusetts, Bay State Medical Center. And if they say have 70 million people covered, well, at $1.3 billion is less than $20 a member.
Whoa.
I mean, this is a big
Nothing
burger. Yeah, no, nothing burger.
Just stop. Whenever every new technology has always had skeptics who were stuck in the past with a perspective that was permanently locked into where they are and pointed backwards. And if that's your perspective, David, I understand it, but you're wrong. You would have said, what's this big thing about personal computing anyways? How about this, like, smartphones? Who needs a smartphone? I mean, come on. This is that kind of change. I don't know that this company is the Microsoft or the Apple, but I will tell you that healthcare is demanding more access, more intelligence, more convenience, the kinds of things that every other industry in America has collapsed their supply chain, and things are much cheaper, leveraging digital tools and more intelligence. This is perhaps the first relevant market company that's doing that. There are software companies aimed at every other industry in America. There's many of them that are over 5 billion, because software is eating the world. And what that means is software replaces people and process and infrastructure, reduces costs, improves outcomes, and dramatically improves the service level. That's why people are jacking this valuation up. And I think this company and more will be coming. And you will be proven wrong, and you will eat your words, David.
John, I thought software is going to eat my words for me. But John, the thing is this. All right, so it's impressive what they're doing, but you pointed out it's not the next Apple. I mean, it's not like this is the last chance. There's many organizations that can do exactly what they're doing, including a lot of the health systems. So I want to turn it back to you, John, and say, I mean, what are the challenges? You're very optimistic about it, but come on, what is the challenge? It's just they've got to be wondering how they're going to maintain this.
Challenges, because look, there's in our $4 trillion-ish healthcare economy, there's a lot of institutional players, big hospitals, big doctor groups, plenty of service providers, tens of thousands of people who just spend their times transcribing and retranscribing, billing and rebilling, fixing bills, changing bills, all of which could be replaced by digital tools and processes, but they all have constituents. But what's really exciting, David, is in a COVID time when people are terrified of infection, and it's one of the reasons why visiting the hospital is one of the fastest growing risks of death in the America, is because of infection risk. It's become personal to every mother and child and family member that engaging in healthcare can be dangerous if you have to do it in person. And that has dropped a lot of the barriers. And you're seeing it in massive regulatory flexibility instantly available at the state and federal level. And I think that's going to create enormous new market opportunities. And to your point, there doesn't have to be one winner. There could be many, but digital is going to win, David, and your institutional friends are in trouble.
John, I like this topic because we can so easily disagree on it, whereas we often end up agreeing. So, all right. So now, we expect that this new big Teladoc is going to come marching into your home care turf at CareCentrix? I mean, is it you're going to just give up the ghost and say just
I,
turn it all
I
over to Teladoc?
Teledoc is we would welcome more access to the tools that Livongo and Teledoc, or I don't think they've really changed their name. I'm not going to come up with a crazy version of it, but I think that we are actually leveraging digital tools. Unlike in your business where it's a people shop, what we're doing is we're leveraging bots, we're leveraging intelligence on demand, we're leveraging the same kinds of digital tools, and we're actually making it simpler and easier for the service agencies that really do have to, whether it's therapy or home health care, to allow them. We're providing and accelerating their access to digital tools. So yes, I do think the strategy of physical to digital, leveraging information, creating intelligence and service on demand will be very much a part of where CareCentrix transforms care to the home. But the only balancing thing I'd say, David, is I don't think you can ever eliminate the power of human connection and assessment. I think there will always be, even though I'm very bullish on a digital future taking out probably $1 trillion of costs in the healthcare system. Honestly, could probably help take out 20 to 30% of the costs. I think it'll also ironically create more time availability for nurses, personal care assistants, and doctors to actually spend more time focusing on what they need to do, which is assessment, care, and kindness, and take them out of all of the administrivia that burdens them. We're not there yet, but I actually think digital will be the handmaiden of injecting care back into the healthcare system.
Well, John, as you know, I'm not completely down on digital, and I think in fact what's happened here is that during the pandemic, people have had an opportunity to experience firsthand what digital care is about, what telehealth is about. They see they like it, they see it has broad applicability, and what this expresses is sort of a supply versus demand. There's a shortage of companies like Teladoc that have been out there for 20 years building up this business, and investors are going after it. I think that's probably what the valuation is showing, and I think it will be a spur to others. And John, you're leading the way, or you're at least a
We're
fast
trying. No, we're
follower.
partners. We're partners in this digital evolution. But David, what's your view on what are the big barriers for Teladoc and Livongo? If you're modestly positive, I mean, I do think that at scale, digital entities could improve care and drop costs. But why don't? What do you think the barriers are? You're in this day
I
to day.
just think that, I mean, certainly the kind of the payment model and reimbursement structure, and
What
whether
does that
some
mean?
well, it means, am I going to get paid for doing this? I mean, it sounds great that I'm going to manage chronic conditions with a coach and I'm going to have telehealth, but maybe the insurer is not going to pay for it, or the hospital is going to take it on, themselves. And I think it's going to struggle to get into the mainstream. I mean, I've done a bunch of telehealth visits. I haven't heard, Teladoc hasn't been at the party when I've been there. And this is really unlike something like Facebook or Google or one of these other tech plays. It's just not a winner take all kind of approach. And so, yeah, they can be successful, but they could be successful like a hospital is successful. And
But I
that's
think, I
about
think,
it.
but I think, but I think what's kind of interesting is that in COVID, all of these hospitals and doc offices went almost overnight to digital, and I actually don't think. And certain care definitely was eliminated that has to come back because hospitals and doctors' offices were effectively dentists were shut down. But there's a lot that I think they found could be done digitally or over the phone or through a video conference. Do you think? I think that's going to stay. What do you think?
No, I think you're making the right point, John. But like I said, they switched over to digital, and they didn't need Teledoc. It's not like they switched over to video conferencing and used they had to use some platform. They already had platforms. There are a lot that were out there. But John, I'm glad to hear that we're coming to the end of this, and we're going to have a chance to continue and see how it goes if once the merger
We,
is approved and consummated.
you'll be wrong.
Okay, that's fine. But at least for now, we can close it off here with the end of yet another beautiful edition of Care Talk. This time talking about Teladoc. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Embrace the future.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.